DG Wang Haidong from NHC. So they will talk about how to provide assistance and help to the vulnerable groups, and in particular the elderly. Let me first give you the updates of the epidemic. Yesterday, between 0 and 24 o'clock, China's mainland reported newly increased confirmed cases 11, new fatal cases 13, all of them in Hubei, and new suspected cases 17. Yesterday's cured and discharged cases 1,430, close contacts removed from medical observation 2,174, and the number of severe cases dropped by 410. By the end of yesterday, China's mainland reported that for remaining confirmed cases 12,094, including 3,610 severe cases. In accumulative terms, the number of cured and discharged cases 65541, fatal cases 3189, confirmed cases 80824, and the remaining suspected cases 115. In accumulative terms, close contacts traced 678935, and close contacts still under medical observation 10879. For Hubei province, the new confirmed cases 4, all of them in Wuhan. The new cured and discharged cases 1,390, including 1,254 in Wuhan. The new increased fatal cases 13, 10 in Wuhan. The remaining confirmed cases 11,772, including 11,098 in Wuhan. Here you may find the severe case numbered 3,543, including 3,410 in Wuhan. In accumulative terms, 52,943 cases are cured and discharged from hospitals, including 3,651 in Wuhan. Fatal cases 3,075, including 2,446 in Wuhan. Confirmed cases totaled 67,790, including 49,995 in Wuhan. There's no suspected cases, and the remaining suspect cases 34, including 30 in Wuhan. Yesterday, between 0 and 24 o'clock, the newly increased imported cases 7, including 4 in Shanghai, 2 in Gansu, and 1 in Beijing. By the end of yesterday, altogether, there have been 95 cases imported. In accumulative terms, we have received 197 confirmed cases from Hong Kong, Macau, and Taiwan, including 137 from Hong Kong SAR, 10 from Macau SAR, and 50 from the Taiwan region. Outside Hubei, other provinces have 7 confirmed cases. All of them are imported ones. The new suspected cases 17, and there is 0 fatal case. For severe case, the number is dropped by 5. The existing and the remaining suspected cases have been on the decline. And for cured and discharged proportion, 72.9%. And in Hubei province, excluding Wuhan, is larger than that, is smaller than that, but much larger. So we are moving towards a sound momentum in the pandemic control by monitoring the high, medium, and low risk areas. Up to now, we can see the majority of the country is in the low risk rank, and the provinces have already disclosed the lists of the high, medium, and low risk areas. That's all for the updates, and now we will have the Q&A. Please focus on today's topic and please identify yourself. The floor is open. First question on the right, on the front row, the journalist in black. Thank you. With China Media Group, CCTV. Over the past 2 years, there's a downward trend in the economy, and this pandemic has exerted further pressure on the economy. So will people's life and the economic development be affected? We will have DG Fu to answer the question. Thank you for your question. And in particular, I'd like to express my appreciation to your concern over the life of the vulnerable groups. Let me answer your question with 3 sentences. That is, first, their lives will not be affected by the pandemic. This year is the year to realize the Xiaokang society, and it is also the critical year to realize the poverty alleviation objective. So it is of great significance to accomplish the targets, just as you have mentioned. Over the past 2 years, we were faced with a downward trend in economic growth. In particular, this pandemic has caused some impact on the economic growth. The fiscal financial revenue has also been affected in the first quarter. However, we should also see that we enjoy a large scale of the economy, and we have the big potential as well as the resilience in the economy. The fiscal revenue is also of a large scale, and we enjoy a fairly big room to deal with the difficulties. By the end of early March, you can see that the fiscal budget for the pandemic control has already hit 199 billion RMB yuan. It is fair to say that the adequate supply of financing will ensure that the vulnerable groups will not be affected by the pandemic. Secondly, the central budget has made prepayment. The central budget has allocated more than 140 billion RMB yuan to help the vulnerable groups, such as the poor, the unemployed, and etc. We are helping the local governments to expand the coverage of social assistance and ensure the social security services are provided. This year, based on previous year's efforts, we will continue to expand the budget. Up to now, we have already allocated 103 billion RMB yuan to ask the local governments to ensure the life of the vulnerable groups. Furthermore, we are providing more fundings to areas suffering from the economic imbalances, and we are trying to ensure that every penny is spent on the right place. So for the next step, together with the Ministry of Finance and the sister agencies, we will make sure that the fund will be provided adequately.
In particular, we will channel to Hubei province hard-hit regions and the financially difficult provinces regions, so that our subsidies could be precise. We will also enhance the monitoring of the funding, accelerate the channeling, ensure physical departments at various levels can ensure the subsistence allowances for the vulnerable group will go to those who most need it. Thank you. Next question, please. Journalist from the first row on the left side. Thank you. with the CRI of the CCTV group. The vulnerable households face greater difficulty in the context of the epidemic. What are the measures adopted by the Ministry of Civil Affairs to safeguard their life? Thank you for your concern on the help provided to the most vulnerable households. As you've mentioned, in the response to the epidemic, the vulnerable suffered the most, though all of us have suffered. With the decrease of income, increase in their expenditures, and the services provided to some challenged people. On the 25th of January, Civil Affairs Ministry has issued a notice to local governments to enhance the help provided to the vulnerable households by streamlining the application for subsidies and designate people to take care of dependent, disabled, or older people. We've noticed that a bigger scope of beneficiaries are covered by these favorable policies. On the 6th of March, we've also issued another notice to ensure the basic needs of the vulnerable could be met during this process in responding to the epidemic. Ministry of Civil Affairs have adopted the following measures. First, pay in full and in time the subsidies to the vulnerable households, the destitute, the orphans, and the physically challenged. They were the population that enjoyed these subsistence allowances from the central budget. There are 43 million destitute people, 40 million plus orphans, 10 million plus disabled. So allowances must be distributed to them in full and in time. For the regions that are heavily hit by the epidemic, subsistence allowance need to be increased. For example, in Hubei province on the 20th of February, there was already deployment to increase the subsidies provided to the above-mentioned vulnerable households. 500 per capita in urban areas and 300 per capita in rural areas. There are similar provisions adopted by Chongqing municipality for the infected vulnerable people. Apart from the subsistence allowances, it will be multiplied by 2 and be distributed monthly. Besides, for those who should enjoy such allowances must get allowances. Impacted by the epidemic, some of the original migrant workers could not get a job and they were stranded. The subsistence allowance system requires that the income level of the household, and also there are requirements on their property ownership. And some of the families who didn't need subsistence allowance because of the epidemic now need allowances. Per capita income level 624 for urban citizens, and in rural areas is counted as 445 per month. If your family income is lower than this criteria, then you can enjoy the subsistence allowance. Besides, to enhance the risk response capacity of those who need subsistence allowance, we've also improved our policies because the subsistence allowance is dynamic. Some may enter into the group, some may exit the group. But now we've stopped these dynamic changes. Third, for the patients of the coronavirus infection, in particular those ones in the vulnerable group, more efforts have been made to enhance the help supported to them. And the non-local residents, once contracted the disease, could claim temporary subsidy at the place where they are stranded. We know the subsistence allowance needs your permit of residence before you can collect the allowance. But for those who are stranded in non-resident locality, we allow the application and collection of allowance subsidies at the places where it's not their residence. And also the families, households who were quarantined because of the epidemic, who enjoy the subsistence allowances have also been increased. And other social relief system, if they cannot cover, the existing system cannot cover the vulnerable group, subsistence allowance must be provided to them if existing system fail to cover them. We've also entrusted community workers to help us. Once community worker has identified such vulnerable household, immediate support and relief should be provided. Also, other staff and people who have been stranded in certain areas and could not seek a job, help can be provided. Subsistence can be channeled. We've also streamlined the application, review, and approval procedures so as to facilitate their collection of subsistence allowances and other help. Thank you. Next question, please, journalist from the third row on the right side with Phoenix TV. Nursing homes in the United States have shown cluster cases and a high fatality rate. What were the measures adopted by the Chinese government? What are the precautions for the homestay older citizen? I'd like to ask DG Wang Haidong from National Health Commission to take the question. Thank you for your concern in the health of the old-aged. We know the old-aged suffer a compromised immune, and many of them have underlying comorbidities. They are most susceptible to the COVID-19, and they are the key group. National Health Commission pays great attention to the protection of the old-aged health. We've established a mechanism targeted at the prevention and control among the old-aged. In the early stage of our prevention control efforts, we've circulated notices on the measures, and we precautioned the localities and nursing homes to adopt certain measures. Second, we focus on the prevention control in nursing homes and homestay old-aged. The Joint Prevention Control Mechanism, with its joint task force, have issued an array of documents, technical guidelines, and also the guidelines for seeking medical treatment for the old-aged in nursing homes. All these were aimed at standardizing practices. For the homestay old-aged, we've been leveraging the roles of communities and GPs to manage their health, in particular the old-aged who are unable to take care of themselves and who are living in solitude. Besides, we've also improved our advocacy and the dissemination of information. In the early stage, we've written a letter to all Chinese old-aged to help them to better understand and correctly face the epidemic. They shouldn't be dragged into panic. They should adopt the scientific practices, their lifestyle, their habits. We've put forward health tips and suggestions.
Health promotion materials using simple language and interesting forms to promote health knowledge and tips. We've already distributed a lot of such health promotion materials which are easy to comprehend and implement. Furthermore, we have strengthened monitoring and evaluation. In particular, we visited and inspected the nursing homes and the nursing institutions for the aged. Fifthly, we have put special attention on the elderly relatives of the frontline healthcare professionals. NHC has earnestly implemented President Xi's instruction, and with the joint control mechanism, we took the lead developing and releasing the policy circular concerning the care provided to the elderly family relatives or members of the frontline healthcare professionals. Their daily lives should be guaranteed, and this is conducted to remove the concerns and worries of the frontline professionals. By doing so, we wish to build a safety net for the elderly, ensuring their health and life. Thank you. Let's continue the Q&A. On the left, on the second row, the first gentleman, please. Thank you. With Xinhua News Agency, to ensure the safety in work resumption, in some localities it is required to have 2 weeks quarantine, some conducted in hotel. However, it is reported that a couple asked to have quarantine need to pay 1,000 more RMB yuan for such quarantine services. So will the government provide the last line of defense to help these deprived population? Thank you for your question, Mr. DG Fu, to answer the question. Indeed, for people who stranded in the localities outside their hometown, at the moment the policy is where they stay, the locality will be responsible to help them. So during their stranded stay, they would be included in the temporary assistance. The fund requested should be provided by the local government and supplemented by the central budget. So this is the policy arrangement. As far as we know, the localities are implementing this policy. Thank you. Let's continue. On the left, on the second row, the lady reporter, please. Thank you. With Hong Kong China Review, after the lockdown in Wuhan, some people have to be stranded in Wuhan. It is said that all of them can receive 3,000 RMB yuan as allowance. Is that true? And is it open to everyone who is stranded in Wuhan? Any other specific measures to help them? We will have DG Liu to answer the question. Thank you for your question. Yes, indeed, just as you have mentioned, since the outbreak of the epidemic, because of the travel restrictions and the lockdown, there are some people who are stranded in Wuhan, and they are faced with difficulties in their livelihood. That's why the State Council, especially the leadership team, has made a special arrangement for such people. There are mainly 2 measures for them. The first one is for those who were trapped in the city. In the light of their needs, they can be provided with temporary boarding. And the second, for people who cannot find jobs and who cannot receive family support, mainly the migrant workers, they can get the temporary allowances, mainly in cash. For people who are stranded in Wuhan, on January the 29th, Ministry of Civil Affairs made an arrangement requesting the localities to provide social assistance. Afterwards, the localities implemented the policy, and then on January the 31st, the local civil affairs authorities developed specific measures to provide assistance to people who stranded in Wuhan and affected by the epidemic. So they will be given 4 to 6 times of the subsistence allowance to overcome the difficulty. Furthermore, later there's another policy notice, that is the 3,000 allowance that you have mentioned. It would be calculated as a once-for-all allowance based on the days they stranded, and then later, in the end of January, the city government worked out another plan providing more services apart from the livelihood. This is set by the local government and in the light of the local conditions. So 2 major measures. The first is to provide boarding, and the other is to provide cash assistance. By the end of yesterday, there have been 69 settlement points established, and more than 4,000 people have been provided with such boarding help, and also 107 million RMB yuan have already been distributed among the eligible people. And of course, there are other temporary or interim measures, and it is a comprehensive package. So, in terms of the last line of defense provided by the government, the boarding services and the cash support are the 2 major measures. Furthermore, in order to facilitate the access to such help, the deprived can apply to the local communities. Also, they can call the hotline for social assistance to apply for such assistance. The Wuhan local government has also developed a QR code where people can get access to the application. Okay, let's continue. On the right, on the 3rd row, the lady reporter, please. Thank you. I'm with the China Media Group. I'm representing the netizens of the CCTV news. The epidemic has caused difficulties to the deprived. For example, the household expenditure has increased as they have to spend more on the PPEs and also their daily livelihood. So, what are the new policies put forward by the Ministry of Finance to help them, and how can you ensure the funding for such new measures? DG Fu, thank you. Just as you have rightly mentioned, the epidemic has affected people's livelihood, especially the deprived. They find their life cost increasing and new challenges or difficulties in their lives. In this context, the Ministry of Finance, together with the relevant agencies, have worked out targeted policies to address these problems.
In general, these policies cover 3 aspects. First, improve the relief and support. We've guided local governments to use the budget from the central finance and to combine it with the local budgets to improve the safeguard provided to the vulnerable group for basic needs. We've guided localities to look at the relief that is needed and the price in daily necessities that have seen an increase, so as to calculate and work out the relief money that should be distributed to the vulnerable groups. Besides, because of the living cost increase in the context of the epidemic, we've also allowed localities to have some additional handing out of the cash that can be provided by the central government. So that the vulnerable group may get the money and they will be saved from the impact of unable to work. Besides, medical insurance increase was also considered to ensure that the urban and rural citizens, in particular the vulnerable group, can be covered by the treatment insurance. We know the treatment cost for the out-of-pocket payment can be covered by the central and local finances. The central finance has channeled 26 billion RMB for the treatment costs. This year, the central finance will ensure precise distribution of this money and provide more favorable treatment to the hard-hit regions. Third, policies have been focusing on job and employment support. We've made analysis on the opening of new posts that have a social beneficiary nature and the benefits that can also benefit some volunteers, and also we've been helping the migrant workers to go back to their workplaces. Will also improve the funds that can support poverty alleviation, help farmers to increase their household income. According to the feedback we've learned with the adoption of these measures, the basic needs of the vulnerable groups can be met and safeguarded. We'll also collaborate with other ministries and departments and to distribute the medical insurance coverage, guide local governments and finances to improve their responsibility in ensuring the distribution and monitoring the money used to alleviate the financial impact on the vulnerable group. Thank you. Next question, please. Journalist from the third row on the right side. Thank you. With the 健康报 JKB. Among the medical workers who are working at the front lines, they might be parents, they might be daughters and sons of the old-aged. And back in their homes, volunteers were taking care of their children. So what are the measures adopted by the government to ensure the medical workers are worry-free? I'd like to ask DJ Wang Haidong to take the question. Yes, indeed, after the outbreak of the epidemic, many medical workers have been working at the front line for many days. They have sacrificed their individual benefits for the benefits of the entire nation. But yes, they are parents, they are sons and daughters of the old-aged. And they may even leave their mothers and old-aged mothers and fathers unattended. So, National Health Commission has paid great attention to the issue. As President Xi has signaled, we must provide solid care and support to the medical workers. We've issued notice and measures on the specific measures that can be done to support medical workers at the front lines. In particular, their old-aged relatives. We should learn about their needs, coordinate with multiple parties to address the difficulties. 3 types of services have been provided. First, health services was provided to the old-aged relatives of the medical workers, those who need medicine medicines were delivered. Those who need medical treatment, we arranged some GPs. And for those who need hospitalization, we took them to hospitals. And second, we've also coordinated efforts and asked the nursing homes to come in help and took those old aged to the nursing homes in providing the caring nursing services. And third type of services were one-to-one daily services, including the precaution items that were bought for the old aged, help them to clean their homes and help them to cook meals. Besides, we've also asked the localities to implement these supportive measures. The service items should be under quite a minimum charges. With these arrangements, we aim to ensure the medical workers are truly worry-free and their old age can feel warm and comfortable as if their children were at home. Thank you. Next question. Journalist from the fourth row on the left side, please. Thank you. With Economic News Daily, the leading group on the epidemic response has issued a notice that subsistence allowances can be increased in hard-hit regions. I'd like to ask about the actual distribution of these subsistence allowances. What does it cover? I'd like to ask DG Fu Jinling from the Ministry of Finance to take the question. Thank you for your question. I've reported just now. The Central Finance has made a priority advancement of 130 billion RMB to replenish the subsistence allowances for the vulnerable groups. As we know, in Hubei province, those distributed to the vulnerable group have already reached a value of 8 billion RMB, among which 4.5 billion came from the central finance, 3.5 billion came from the provincial finance. If the city finance and county finance were also included, the funding scale would be even bigger. And as to the question as to what does it cover, well, it focuses on the living expenditures of the vulnerable population, the care cost of the disabled and the orphans. The specific allowance standard has been decided by localities by analyzing their own context. Thank you. Next question, please. Journalist from the fourth row on the right side, please. Thank you. With CNS, some netizens say there has been rise in the prices of pork and vegetables. I'd like to ask what kind of pre-qualifications enable a household to collect and apply and collect for the subsistence allowance. Will there be a difference across the country? DG Liu Xitang is answering the question. The leading group on epidemic response has signaled the importance to notice the price fluctuations of daily necessities. The joint mechanism must be initiated to distribute the subsistence allowance, and this can be increased by different localities. I'd like to share with you the specific performance of the joint prevention control mechanism. Back in 2011, it was already a joint task force for social relief. It should be connected with the price increase of the daily necessity items. And for the vulnerable group, the ones that collect the subsistence allowance, the destitute, the ones who collect unemployment insurance.
Some localities have expanded the coverage. The Joint Task Force was established in 2011 and it is being constantly improved. And then there are specific improvements or amendments. Just now you mentioned the threshold, and this is decided by the local government. However, the central government also indicates that when the CPI's monthly increase is higher than 3.5%, and also when the food proportion of the CPI, once it is higher than 1.6, then that means the threshold is also reached. So either condition is satisfied, then the threshold is triggered. For the joint task force, it is pointing out that once the threshold is reached, then the temporary subsistence allowances would be provided. If the price has been kept quite high with a fairly long period of time, then the threshold needs to be adjusted. As you know, in the year 2019, the price of the pork hiked, and this has also caused the rapid increase of food. So all of the provinces and the municipalities have triggered the threshold, and according to our data, 7.89 billion RMB yuan of allowance were distributed among the eligible population, and the price has been kept at a high level. So starting from this year, this mechanism is still working. So in January and February, 1.69 billion RMB yuan have been distributed, benefiting more than 30 million people. With the new arrangements from the central government, the Ministry of Civil Affairs is now helping the localities to implement the specific measures. In some localities, they have already made arrangements to increase the allowance. For instance, in Shanghai, it is stipulated that the allowance will be increased by 50% based on the previous allowance. Let's continue on the left, on the third row. The lady reporter. Thank you. I'm with China Community News. Because of the pandemic, the vulnerable groups are becoming more vulnerable, causing a lot of concern. So what are the measures adopted by the Ministry of Civil Affairs? We'll continue to have Mr. Liu to answer the question. Yes, indeed. Vulnerable groups like the left behind, elderly, the kids, the disabled, and etc. are in great need of help and care. At the moment, or recently, the central government has worked out a policy circular to make specific arrangements for these vulnerable groups. Namely, first, timely reporting. It is requested that the institutions who are responsible to take in the targets for quarantine, it is necessary to know if the person to be quarantined has family members who are the vulnerable population. So once you quarantine somebody, you have to be aware the people who count on this particular person to be cared. And the second, there should be proper care for the vulnerable groups. In some localities, there are such service agreements. However, if the caregiver is quarantined, then the local community or the civil affairs authorities are requested to provide care and services to the target population. And thirdly, there should be necessary assistance offered and home visit. So just now you mentioned the left behind elderlies, and if there's a need, there should be adequate services provided. On March the 6th, the ministry worked out a circular requesting the local authorities to guide the local communities and the relevant agencies to conduct the screening and provide relevant services and care. Let's continue on the left, on the fourth row, the third lady reporter, please. Thank you. With China Daily, it is reported that in the early days of epidemic control, there were some infections in the nursing homes in Wuhan. So for the frontline working or task force, what are the measures adopted to help them? We will have DG Wang to answer your question. Thank you. Yes, indeed. As you rightly mentioned, in the early days of the epidemic, there were some individual infections in the nursing homes in Wuhan, but all of them had been sent to the hospitals to receive appropriate care. We request the closed-loop care and management and provide the relevant services and care to those who are in need. The local health authorities, the Wuhan and Hubei provincial health authorities, set up a joint mechanism to help these elderly. Second, we strengthened inspection on these nursing homes. By the end of yesterday, altogether, we inspected 738 nursing homes and ensured the implementation of the measures. And thirdly, we strengthened training and guidance. We brought into full play the 1,000 over professional forces who rushed to Wuhan to offer help and trained the nursing homes. By the end of yesterday, altogether, we trained 4,471 person times working in the nursing homes, and also we produced technical guidelines and specific protocols to guide the work of the nursing homes, and we have already distributed such training materials to the nursing homes. We will ensure the sound implementation of such measures and the health and the life of the elderly. Okay, let's continue on the right, on the fifth row, the first lady reporter, please. Thank you. I'm with the CCTV Finance channel. Since the outbreak, some people are in great need of help, affected by the pandemic. So what has the Ministry of Civil Affairs done to help them? Also, in some neighborhood communities or residence communities, they are closed for better management. So how can they get access to the allowances? We will have the DG Liu to answer the question. Yes, indeed. For the deprived or for the people who are in great need of help, they really need the timely help and assistance. So it is a pressing task to ensure their livelihood.
Over the years, Ministry of Civil Affairs has also been analyzing how can immediate help provided. We've adopted the following measures. First, there are hotlines at different localities. Provincial, municipal, and county level service hotlines have been opened to the general public to accept complaints, to taking us, for the citizens to ask for services. Now, the hotlines have already been operated across the country. From across the country, we've collected the hotline numbers, and all these hotline numbers have been publicized on our WeChat account and our official website. If you download our WeChat account, you can very conveniently find the hotline for taking complaints and for the people to ask for help. We hope you can Twitter it more on your WeChats, so more people will know where to go to seek help if they are in need. There are county-level hotlines across the country. Second, we've optimized and streamlined the application procedures for helps. We ask the localities to accelerate the streamlining of procedures and shorten the waiting time of the public. We've also adopted some emergency measures. For example, the original mechanism has been streamlined to the current examination of the financial status quo of the households. It can be conducted without on-site contacts. Video and phone calls are also able to qualify an eligible support asker. We have some online services as well. Third, we've also delegated the review and approval powers to counties and other localities. The county-level Civil Affairs Department can take in the application. We've also delegated powers even to the streets and villages so that the local authorities can review the application for help and can make analysis and approve those who are eligible so that the vulnerable group can get the subsidy more quickly. In general, those who apply for the subsistence allowance can get it from the counters. They can also seek help online. On the hotline, they can also seek help online. Of course, it's based on the informationization level of the locality. On the front of money distribution, currently we count on the financial system to distribute the relief money. Over the years, that has been our pursuit. We wire transfer the cash to the bank accounts of the vulnerables. Thank you. In the interest of time, we can take last two questions. Journalists from the fifth row on the right side, please. Thank you. Enterprise Observation newspaper. We've learned that there were several favorable policies for safeguarding the basic needs of the vulnerable group. Are these measures well implemented at the local level? What were the measures adopted by the local finance? Thank you for your question. DG Fu is to take the question. And thank you for your interest in the central and local finance. I can summarize their answer in two timeliness. First, the measures from the central budget can be implemented timely. By the end of February, total distribution of 33 billion RMB was channeled for the subsistence allowance, and 6 billion was channeled for the support provided to destitute, an increase of 17.6%, 19.4%, and 26.6% respectively. And this has shown that the basic needs safeguard measures from the central finance have been well implemented. Second, local financial authorities have adopted forceful measures. After the outbreak of the epidemic, local financial authorities played a negative role in collaborating other departments and adopted response measures to improve the basic safeguards provided to the vulnerable groups. The vulnerable group who were unable to take care of them got the caring fees to ensure that they are taken care of. And in places, temporary subsidy was handed out to set off the impact from commodity price increase. Localities adopted these measures in context of their own conditions, and they have refined the policies from the central government, made pragmatic and down-to-earth contextualization of the policies, and played a very positive role in helping the vulnerable. Down the road, we will continue to guide local financial authorities to implement good policies, ensure reasonable and fair, transparent distribution of the financing budget, make further efforts to ensure the daily necessities and the livelihood of the vulnerable group could be safeguarded. Last question, journalist from the fifth row on the left side, please. Thank you. Hong Kong Economic Herald. This year we need to realize the goal of the critical battle against the poverty alleviation. But the epidemic has dented certain efforts, so how can we win this critical battle for poverty relief? I'd like to ask DG Liu Xitang to take this last question. Thank you for your question. Poverty alleviation is towards the last year of its campaign. And indeed, the safeguarding of the basic need of the most vulnerable was under great pressure because of the major influence from the epidemic, putting our original battle under greater challenges. On the 8th of March, Ministry of Civil Affairs convened a national conference and to mobilize the local civil affairs departments to work towards the realization of the goal to make holistic arrangements in ensuring the basic needs of the vulnerable and in realizing the poverty alleviation goal. We've adopted the following measures. First, good relief should be provided to the most vulnerable hit by the epidemic. Eligible poor should be included into the group covered by subsistence allowance. Procedures should be streamlined. Comprehensive measures should be adopted, in particular for those who have become poor again because of the hit from the epidemic. As of the end of 2019, we looked at data comparison. 18 million plus households were included in the coverage for the destitute. 16 million plus were the ones that have been lifted out of poverty previously. In other words, these people need to get basic needs met with subsistence allowance. Without subsistence allowance, they would have suffered poverty. 3 million plus got temporary subsistence allowance in the year 2019. Second, we will set up some thematic campaign to these goals. We've collaborated with relevant departments and issued a thematic action plan to ensure the basic needs of those that are not yet lifted out of poverty and those who have unstable income and a greater risk of returning to poverty, and also those who are on the peripheral of in or lifted out of poverty. So we've set up a database to monitor these peripheral people.
Thirdly, to ensure that the minimum allowance is dynamically adjusted to be higher than the national minimum standard. By doing so, we can set up the last line of defense. The national threshold is more than 5,000 RMB yuan, while the subsistence allowance threshold is about 4,000 RMB yuan, and for the extremely difficult regions, it is a little bit over or around 4,000 RMB yuan. So it is fair to say that the last line of defense has been set up. Furthermore, we will prioritize the extremely difficult localities and provide favorable policies and allocate more resources to such areas and localities like the ones in Wuhan. Thank you. Thank you for the speakers. And for today's press conference, the topic is during the epidemic control, the subsistence allowance and financial support to the deprived. And for tomorrow's press conference, we will have representatives from the financial institutions and the banks to talk about how to support the work resumption. We hope to see you tomorrow then. That's all for today. Thank you.